How much does it cost to run a society? If you were following the news this fall, you saw an intense battle over the future of the State Children's Health Insurance Program, or SCHIP for short. At the center of the debate was whether to continue and possibly expand this program, which provides health insurance coverage for low-income children whose families are poor but not poor enough to qualify for Medicaid. The SCHIP debate this fall was widely viewed as a proxy vote for what's shaping up to be the #1 domestic issue in the 2008 presidential election: health care. Just look at all the issues that came up during the SCHIP debate and how they tie into the larger issue of what to do about our health care system. I count no fewer than 10 issues that came up this fall and are sure to come up again. Number 1, taxes. How much is too much? Number 2, state versus national control. How much variability should be allowed in setting state formulas for coverage of people with low incomes? The high-end allowance currently goes to New York Governor Eliot Spitzer, who is proposing that coverage in his state should be extended to 4 times the poverty level for families. That means that families with an annual income lower than $83,000 would be eligible. Number 3, universal health coverage. Should a modern, developed nation accept nearly 50 million uninsured, 1/6 of the total population, especially since taxpayers, in one way, shape, or form, pick up the costs of their care when they get in trouble? Number 4, immigration. Should legal and illegal immigrant children be covered? Number 5, tax incentives. Is it viable, as some have proposed, to use tax credit incentives to encourage low-income citizens to purchase their own health insurance? Number 6, public-private partnerships. Can we afford the increased management costs of the complex processes that come with a mixed public-private solution that embraces variability, decentralization, purposeful lack of standardization, and proliferation of middlemen? Number 7, national leadership. Does the embracing of a free market approach let our national leaders off the hook, allowing them to avoid the tough work of organizing a reliable, preventive healthcare system, which promotes access, quality, and equity? Number 8, the American family. As more and more families become 4 and 5 generations deep as opposed to 3 generations, does it make sense that we have a national healthcare system in which Medicare covers the 4th and 5th oldest generation Americans, a public-private system covering the youngest generation of the family, and a non-portable, variable, employer-based private mishmash of a system that covers the middle, 2nd, and 3rd generation citizens? Should we really have to compete with each other and manage this level of complexity inside our own families? Number 9, national values. How committed are we to the collective security and success of all Americans? Number 10, individual responsibility. If we were to decide that health was a right and that all citizens in the United States must have insurance regardless, what other responsibilities would each of us have to bear in assuring our health and productivity? Would we be prepared to plan, to adhere, and when necessary to alter our behaviors to assure society a maximum return on its investment in us? How we choose to organize, govern, and structure this effort will define who gets what we're paying for, and whether the time and effort and money was worth it. As the saying goes, you can pay me now or you can pay me later. Massively disorganized and variable systems spend a great deal of their time paying later. Compared to other developed countries, the U.S. tax revenues as a percentage of our gross domestic product ranks 17th in the world at 28% of our GDP. But as everyone now realizes, from General Motors to small and large city mayors to millions of Americans on the margins, the true costs of a healthcare system that's confused and our failure to get ahead of our aging-induced disease curves is the creation of a tax burden that will likely exceed Sweden's, and they're currently #1 in the world. Swedes are taxed at a rate of 50.1% of their GDP, but at least they know what they're paying for. For Health Commentary, I'm Mike McGee.